Thank you for watching Penn Foundation's Autumn Hope-A-Thon. Brought to you by American Heritage Credit Union. We offer you the right financial solutions because you're family. And St. Luke's University Health Network, the care you trust now more than ever.
Imagine a financial institution that you own. What does that look like? Would it provide tens of thousands of free ATMs? Maybe it'd be a not-for-profit that gives back millions to its members and community. The kind of place where the CEO is just as accessible as any other team member. A revolutionary partnership forged in your neighborhood and still standing strong after nearly a century. That's American Heritage Credit Union. Start your own financial revolution today.
St. Luke's is ready for you. We're working tirelessly to make sure our hospitals and facilities are as safe as ever. We're all masking for you, and we provide masks to our patients and guests. We're ready for you, screening all patients for symptoms before appointments and offering virtual registration and check-in. We're limiting the number of people in our waiting areas and repeatedly disinfecting waiting and exam rooms. St. Luke's is ready for you so you can stay healthy now more than ever.
Good afternoon, and thank you so much for tuning in to Penn Foundation's Autumn Hope-A-Thon. I'm Melanie Falcon, and I'm happy to be serving as your host for today's event. We'll be here live from 4 to 6 o'clock tonight, and we hope that you'll be able to join us and stay with us as we hear inspirational stories and raise essential funds. So joining me now to welcome you is Wayne McGrower, Penn Foundation's president and CEO. Wayne, thank you so much for being here with us this afternoon.
Thank you, Melanie.
Absolutely.
It's great to be here, and thank you for the support of WFMZ.
Of course, we're so happy to be a part and involved and help this event become a reality this year. As everybody knows, we're in very interesting times in the middle of a pandemic, and usually this event, you said, is a huge gala in person, right?
It typically is, and for many years we've had an autumn event that would attract a national speaker, and we'd have as many as 700 or 800 people gathered together. So this year that wasn't possible, but we're very excited about tonight, and we're excited to tell our story.
Absolutely. We're excited to help you tell that story today as well. So Wayne, you've got quite the story yourself. You have been with the Penn Foundation for how long?
I've been with the Penn Foundation as CEO for 10 years, but I was actually hired as a very young man by the founding medical director of Penn Foundation, Norman Laux, many, many years ago, actually 35, 40 years ago.
Wow.
If you promise not to do the math, Melanie.
I'm not good at math anyway, so
good.
You're in good hands here. And tell me a little bit about the Penn Foundation for anybody who's watching and might not be really familiar with them.
Well, I think the Penn Foundation is a very unique and special place. It is a not-for-profit, community-based behavioral health care program. We have a full range of mental health services, drug and alcohol, residential and acute services, and we also have a psychiatric rehabilitation program and residential services as well. So last year, with about 500 staff members, we saw 19,000 clients and provided about 250,000 services in 9 locations and representing 27 programs.
That's incredible.
It's a lot.
Touching so many people around here. And where are you mainly based out of, and how far is your reach in our community?
So we are based on Lawn Avenue in Sellersville in West Rock Hill Township. Our geographic distribution of services is probably about 15 miles in any direction from Sellersville, although for some of our programs, our drug and alcohol residential programs, we are a center of excellence for the state of Pennsylvania. We are a Blue Cross Center of Distinction, and we are a member of Aetna's Institute of Quality. So people will travel some distance for those particular programs when they're able to stay overnight, as they do in the inpatient program.
Right, all right, that's wonderful. And throughout the evening, we'll be talking a little bit more about some of those distinctions that you guys have. So thank you so much for Wayne for kicking us off here this evening. And we'll be talking to you a little bit throughout the evening as well. Well, of course, there is so much to cover in our next 2 hours, but I can promise you that you are in for an inspiring, educational, and entertaining event. So thank you for joining us as we come together to support Penn Foundation and the vital mental health and substance use disorder services that they provide to our community. So before we get further into our program, I want to introduce you to the Penn Foundation volunteers who are here in our studio this afternoon. So when you call in with your support, you'll have a chance to speak with them. We've got Brad, Brian, Rhonda, Dale, oh, I hear a phone there right now, and Elisa. Now, all of these individuals have volunteered to take your calls as you step up to help us raise $150,000. That is our goal this evening in supporting the Penn Foundation. Now, in fact, some of you may have already sent in your support in advance of our live event. So I'm going to get to that number right now. Penn Foundation has actually already raised $82,250. That's an incredible progress towards our goal, but we still have a long way to go. So throughout our broadcast, donations can be made by calling 610-841-4441. You're also invited to visit an online auction that we'll be having. There are dozens of items to bid on, and 100% of the proceeds from those will benefit Penn Foundation's 27 programs. So you can check out all the details at pennfoundation.org. All right, now we're going to talk a little more about mental health because it's a topic that we've been hearing more and more about lately because of the global pandemic. The CDC has reported a considerable increase in anxiety and depressive disorders, as well as considerably elevated levels of substance abuse and suicidal ideation. But even before COVID-19, 26% of Americans 18 and older, that's about 1 in 4 adults, was suffering from a diagnosable mental disorder. And that's according to a study conducted by Johns Hopkins. And for 65 years, Penn Foundation has been helping individuals who struggle with mental health disorders. Now you're about to meet George. George came to the Penn Foundation in dire circumstances. His mental health had deteriorated to a point where it was hard for him to take care of himself. But with the assistance of the assertive community treatment team at Penn Foundation, George was able to participate in care that helped him reclaim his life. Today, he's thriving and wants to share his story with you.
I did not come out with my mental illness till I was about 28 years old. Up until then, I lived a normal life. And then when my mental illness came out and people told me I had mental illness, I did not take it into consideration. I used to think the government was out to get me, and I had people chasing after me. I had multiple suicide attempts. They were pretty serious suicide attempts, but a doctor recommended that I try out the Penn Foundation, and I met with Craig Oliver, and Craig Oliver explained the program to me, and it sounded like a great program, so I agreed to sign up. That was the beginning of my journey. My life is very different now that I've been in Penn Foundation. They've taught me about my mental illness, how to deal with my mental illness. They've taught me how to set goals. The Penn Foundation helped me manage it well. They got me on the right medication, and I'm having a huge success in my life. Well, the ACT program, they have groups every day where the clients come out and discuss, maybe things that are going on in their life. One client, she talked about how she was going to college, and I thought, wow, she's going to college, maybe I can go to college. And then I started going to Montgomery County College, and then that's when I became a realtor. My therapist, Randy, he encouraged me to start walking because I have lost weight, you can't really tell, but I lost about 50 pounds because Randy kept encouraging me every week when he came. I want you to tell me you did 10,000 steps a day, and I started averaging 20,000 steps a day, which is about 9 miles. I'd send out pictures of the scale every morning to friends and everything, and people are like, you are just melting away. Had I not have joined the Penn Foundation, I probably would either be sitting around with no goals, no hope. I would not have had the success that I've had. And if anything, I might have had a successful suicide and I'd be 6 feet under. The Penn Foundation has definitely been a very good experience for me. I even consider some of the staff my friends. I look at them as more than just a therapist or just a counselor or whatever they are. You know, I feel like they really care about me, and I really care about them as well. Well, the reason why I shared my story is I just want to be able to help somebody, even if it's just one person. I hope I can help many people overcome challenges that they're facing, whether it's with their mental illness or any other struggles that they're having in life. I was really at a low point, but you just got to take everything day by day. It took me 8 years to get to the point where I'm at today. If my story just helps one person, that's all that matters to me.
Wow, what an inspirational story from George, and I love that he wants to help just one person. So just by sharing his story, he is inspiring others to seek help. And in addition to helping many others, I'm certain that his story touched many of our viewers right now. So if you're one of the individuals who is inspired by George's story and you wish to help others like George, please call in now with your donation at 610-841-4441. So with me in the studio now to help us learn more about Penn Foundation's mental health services, we bring back Wayne McGrower, President and CEO. Thank you again, Wayne, for being here with me.
Thank you, Melanie.
All right, so talk to me a little bit about the misconceptions of mental health.
Well, I think many people don't really understand the prevalence of mental health issues. So what we know is that in their lifetime, 50% of Americans will have a mental health issue. And in any given year, approximately 20% of our population will have a mental health issue. Mm-hmm. So these issues are very common. They're very treatable. And what we know is that people with treatment, who get access to treatment, can live full and independent and meaningful lives. Of those people who have a mental illness, about 5% of people have a serious mental illness. And not unlike remitting and relapsing medical illnesses, these are illnesses that will require attention and support and professional care for a person's lifetime. Mm-hmm. But the outcomes, as you just saw, the outcomes that are possible when people receive care, when people step forward, when they really understand how they might benefit from that care, how their families might benefit, how they can go on to live full and independent and very positive lives, that's so meaningful. And I don't think that's widely known.
Right, absolutely, that it is something treatable and something that you can recover from and live with every single day in your life.
Absolutely, and you know, I often say that no one chooses to be ill, mm-hmm. and no one chooses their illness. Mm-hmm. So while there's been stigma associated with mental health issues and with addictions issues, the reality is that people don't choose those illnesses. They're diseases like any other physical health disease.
Mm-hmm. Absolutely. And you mentioned the stigma and how taboo they are. You know, in some families, it's almost shameful to have a mental illness. How do you help people, you know, get that encouragement to seek that help when they need it?
Well, I think over the course of my career, I've seen a real change in that. I think that people are much more willing and mm-hmm. understanding of what mental illness is, what addictions is, and they're much more willing to receive treatment. And you know, the 1990s and the early 2000s were really the decade of the brain, and there was a great deal of research, science and psychopharmacology that was developed that can really help people live normal and productive and positive lives.
Absolutely, and I think just by being here today and sharing all of these stories that you'll hear throughout and hearing from you, I think it's just really going a long way to continue spreading the word and get people talking about mental health. So, Wayne, thank you so much. We'll check in with you again in a little bit. But right now, let's move on to our first musical performance for the day. And this one features Craig Thatcher, who's the band leader of the Craig Thatcher Band, an international clinician and ambassador for C.F. Martin & Co. of Nazareth, PA. Craig has performed in one capacity or another in nearly every U.S. state and over 35 different countries. Craig is half of a very dynamic duo with violinist Nick Van Wyck. The two perform all over the Lehigh Valley, locally at the Sellersville Theater, which is right in Penn Foundation's backyard, and they also perform as far away together as Ireland, Scotland, and Italy. So as you listen to Craig and Nick perform one of their original pieces, now is a great time to call 610-841-4441 with your donation, or you can go online to pennfoundation.org to bid on the items in our online auction. So now let's enjoy Where Shannon Meets the Sea by Craig Thatcher and Nick Van Wyck. those two just sound so incredible. And what is even better is the update that I just got during that amazing performance from our call center volunteers. So joining me now to share that update on our fundraising total is Penn Foundation's Vice President of Advancement and Communications, Kim Datweiler. Thank you so much, Kim. It's good to see you today.
It's good to see you. Thank you so much for having us here.
Absolutely. So tell me, what are we up to now? I've heard those phones ring a couple times.
It is. It's exciting when those phones are ringing. We're sitting over there, and every call we're anticipating what is the amount, but support is coming in, and I'm pleased to announce that we're at $96,125.
Wow, that is awesome. That's a huge jump since we first started our program. And again, our goal today is $150,000. So in addition to calling, again, the phone number really quickly, 610-841-4441. It's right there on the bottom of your screen, or you could go to pennfoundation.org. Again, we've got those auction items on there that you can definitely check out. So tell us a little bit more about those.
Yeah, definitely go on to pennfoundation.org. That is where the auction information is. You can register to bid. And there's something for everyone. We have more than 40 items in the auction. There's family experiences, there's some pottery, there's things for all ages. We have purses, we have trips, there's some travel opportunities, and those travel trips, maybe not something people are thinking about right now with our current circumstances with COVID, but you're able to do that within 2 years. So there's some great opportunities there, and check it out and get bidding, please.
Yeah, we've got pictures of some of them up on the screen, and they looked wonderful. Those are all thanks to some area businesses that stepped up and helped out, right?
Yeah, we didn't know what to expect this year, but we've had tremendous support from businesses and all of the donations. We've had individuals, our staff, even our staff stepped up and really helped make some of those wonderful baskets that are on the auction. We're really just thrilled with the support that we had from businesses with the auction.
All right, yes, thank you to all the businesses who donated and helped out today. So again, be sure to go to pennfoundation.org and bid on those auction items. The auction will close tonight at 5:45. So you still have well over an hour to bid on all of those items. So throughout the show today, we'll be recognizing our founding level sponsors. So let's begin with a few messages from Bergey's and Locker.
At Bergey's Auto Group, we are creating new ways to be driven to serve.
Keeping safety a priority, our 7 local dealerships deliver a transparent, fast, and convenient sales process that our customers love. You can shop from home or in our showrooms.
Bergey's is also a great place to sell your car. Visit Bergeys.com to get a Kelley Blue Book certified offer for your vehicle in minutes.
Start your Bergey's experience at Bergeys.com. Bergey's, a trusted name since 1924. Driven to serve!
Hi, I'm Molly, a senior client manager here at Locker. I've been here for almost 5 years now, and one of the things I love about Locker is that we work hard for your business and take care of keeping you a satisfied client. If you're looking for insurance for your auto, home, or yourself, let's chat.
Thank you for watching Penn Foundation's Autumn Hope-A-Thon. Brought to you by American Heritage Credit Union. We offer you the right financial solutions because you're family. And St. Luke's University Health Network, the care you trust now more than ever.
Imagine a financial institution that you own. What does that look like? Would it provide tens of thousands of free ATMs? Maybe it'd be a not-for-profit that gives back millions to its members and community. The kind of place where the CEO is just as accessible as any other team member. A revolutionary partnership forged in your neighborhood and still standing strong after nearly a century. That's American Heritage Credit Union. Start your own financial revolution today.
Welcome back to our live coverage. As I've gotten to know more about Penn Foundation, I think what makes it so special is its caring and compassionate staff. Many of them have loved ones touched by mental health and addiction, and some even have recovery stories of their own. Matt and Christy are 2 such individuals. Their stories are full circle stories. 2 people who came to Penn Foundation for help and are now helping others as certified peer specialists. So let's learn more from Matt and Christy.
I was basically homeless, living in a respite, when my caseworker from another provider did a referral and got me an interview to come to the Village of Hope. The moment I stepped in there, even for my tour and my interview, I felt welcomed, the staff seemed like extended family who really cared. All the ladies seemed supportive and understanding where I was coming from. I did get accepted, and 2 days later I moved in, and it was the start of my journey to stay sober and to build my mental health recovery. During those 2 years, I really got to grow as a person. My mental health was strong, and I was sober. Today, I have 6.5 years clean, and a lot of that is due to the village, because I know if I didn't go there, I would have ended up using again and probably would be an institutionalizer debt. I got introduced to peer support through groups they had. We had 2 peer specialists coming in to run groups, and the peer specialists kind of showed me that these people have lived experience and they're willing to share it. I started working with Carlene, a peer specialist, and she helped me with the transition moving out, and then she helped me see that I could become a peer specialist. I always wanted to help people, but I never knew where to go because I didn't have a full college degree. Role modeling her, it made me realize that could be a goal, and she walked me through the steps on trainings and everything I needed to do. She was there when I got accepted into the Montgomery class and I graduated. And my main goal was to become a peer specialist, but my top goal was to work at Penn Foundation. I got hired. I still remember the day Jane called me. And since then, it's been like amazing to work at. And I'm glad I'm still at Penn Foundation. And then on top of that, I now work part-time at the Village of Hope as a residential advisor, where I'm basically able to share my lived experience and show empathy that I understand what these girls go through and show them that you can do the full 360 in your recovery and give back to others.
What brought me to Penn Foundation was after college, I was really struggling with anxiety and depression. I definitely struggled in both high school and college, but kind of put everything all my mental health stuff to the side because I wanted to finish school. It really took a toll on me. I wasn't able to work, and I was just not in a great place. I started going to Penn Foundation for therapy because my family had gone there previously, and my therapist connected me with recovery coaching. She asked me what my plan for my future was, what I wanted to work towards, and I told her, I really want to use all that negative experience that I had in school with my mental health challenges for something positive. And she was like, oh, well, I have this pamphlet here for peer support. And I looked at it and I was like, oh, this is exactly what I want to do. That's when I got connected with the peer support department, and I worked with my peer specialist, Ryan Schwager. I felt like I went from just kind of like treading water in my recovery to doing stuff like this, which I never could have imagined I would be able to do. With a lot of support from Ryan and my other supports at Penn Foundation, I took the peer specialist training and then got a job at Penn as a driver on the FAC team. And when an opening for the peer support department came about, they asked me to step in. When that spot became permanent, they asked me to stay on, and Ryan became my supervisor. It was just amazing to have that change from Ryan being my peer specialist to being my supervisor, and I've been on the team for just over 3 years now, and it's been awesome. I think Penn Foundation is just an infinitely valuable service. I was able to utilize so many different things by coming to Penn Foundation. Therapy, recovery coach, peer support, the REACH program, Clubhouse, all of them helped me in very different ways, and they all helped me grow in a very holistic way, improving physical health, mental health, developing skills around independent living, just having that choice available to me for different stages of my recovery was extremely valuable to me.
I think it's important to support Penn Foundation because, like Matt said, it offers so many services in one spot. In most agencies that I've been part of as a client, it's very like, we offer this and then you have to go to this person, and you never feel like connected to one resource. I was at the Village, so I utilized all their staff, their psychiatrists, their therapist. I was part of the REACH program, peer support, and now I'm able to give back Without the funding, Penn Foundation wouldn't be able to offer all the amazing services. I think it's the only organization where you can come to one spot and get every service from the beginning. If it's substance abuse, start in our rehab, go to IOP, then you can move on to mobile services, and then you continue your venture on with those supports that will just keep growing with you.
And we're back here live in the studio, and joining me now is Penn Foundation CEO Wayne McGrower again. So Wayne, I want to start by congratulating Matt and Christy on their recovery. Just so inspiring to hear their stories and how they got help, and we're even committed to paying that forward to others.
It's extraordinary, isn't it?
Yeah.
Very inspirational. And I think one of the benefits of Penn Foundation is we have 450 people who have remarkable compassion, dedication, professionalism, and they lean in every day for our community. You just heard the story of two individuals, and you can imagine the stories that exist within those 19,000 people that we cared for last year. And I think this past 6 or 7 months, as we've all worked through the issues of COVID-19 and changed the way we provide service and the way we care for the community, our first goal was to take care of the people who really are most vulnerable among us. And our staff, like for all first responders, essential staff, kind of metaphorically ran into the burning building. Without regard to themselves, they put other people first, took care of their needs, and it's so inspiring. So it's not only peer specialists who walk that journey with our clients, it's also nurses, physicians, counselors, techs, therapists. It's really a multidisciplinary approach, because one thing that we know is, every one of those 19,000 people has an individual story. And one size, one issue, one program doesn't fit all.
Absolutely. And talking a little bit more about these peer specialists like Matt and Christy, I think that going through what they've been through probably gives them a unique perspective in helping other people who have similar struggles.
I think by all means it does. I think what it offers people is hope. It gives people an opportunity to build relationships with someone that they can see as a role model, so that they understand there is hope for a future. And as you saw in those two stories, sometimes that future involves being a professional at Penn Foundation. But absolutely, the ability to connect with people who have lived your experience, who have walked that mile, is so important for so many.
Absolutely. Now, if somebody at home is watching right now and struggling a little bit, what's the best way to get connected with Penn Foundation services?
Well, it's really very easy. Of course, our website, pennfoundation.org. You can go there, read about the programs, or call our office at 215-257-6551.
All right, wonderful. Thank you so much for sharing those resources with us. And I know we'll go over them again throughout the show as well. But right now, we want to talk about our next musical performance. So keep calling and keep bidding with all of your support as we go to this next one. We're going to hear some beautiful piano music from Michael Borowski. Michael is well known to our viewers in this region. He's been entertaining audiences both locally and nationally for decades. Now, Michael's original compositions recently got the attention of Grammy-winning producer and founder of Windham Hill Records, Will Ackerman, producer of music legends like George Winston. Now, Will is currently producing Michael's first solo album, which will be released later on this year. So now, please enjoy Arches, composed and performed by Michael Borowski. just a lovely performance. I think we all feel relaxed now. So thank you so much, Michael, for sharing your music with us. And for more on Michael, you can visit michaelborowskimusic.com. So here with me now, we have Dale Westwood, chair of Penn Foundation's Autumn Hope-A-Thon Committee. So Dale, I want to get another update on how things are going right now.
It's pretty exciting.
Yeah.
We just reached $100,000.
Woo! All right.
Woo.
2/3 of the way. That's great. Our volunteers on the phone. Shout out to you guys again.
Yeah.
Thank you so much. Oh, phone's ringing right now.
Yes.
Who's going to get it? All right. Awesome. We'll keep those calls coming as we talk with Dale a little bit here. So we're 2/3 of the way to the goal. That's really, really awesome. We want to talk about that online auction. It's going on right now, pennfoundation.org. You've got some cool stuff, and I see some goodies next to you here.
I know. Want to talk first about the book club. Is the book club here? Where is it? Well, I want to talk about the book club. So anyway,
it is a book club.
Okay. So I was kind of excited about this because I've always wanted a book club, and it's like, how do you start one? And Fun Basket by Doylestown and Alaska Bookshops and the blog Two Flew Over the EmptyNest.com. But it's going to give you everything you need to start a virtual book club. It gives you enough books for the first 6 months. It gives you some tips. It throws in some things like cozy socks and herbal tea and all kinds of fun stuff. So we're really excited about that. We have some specialty food baskets, and one of them is from Landis Supermarket, and it has their famous baked goods. I'm not sure, Melanie, have you ever had a Landis Supermarket baked good?
I don't think so.
Well, I think you should try one because they are so yummy. And included in that basket is a gift certificate, I believe, for $25 for groceries. Awesome. And also, we have an outdoor basket of fun for children, and that was donated from staff at Penn Foundation. And I know my grandchildren are spending a lot more time outside right now during the pandemic. And you know, there's all kinds of goodies like chalk for, you know, the sidewalks and bubbles and games and all kinds of fun stuff.
Awesome.
So,
I've got 2 young kids myself, so I might have to log on next break we have. Yeah, that looks like a good one.
Yeah.
So what are some of the other things that we have online?
Well, we have about 40 additional ones, and ones that I think folks would really be interested in is matching bicycles. You know, through the pandemic, you haven't been able to find bicycles. And there are 2 bicycles on there made specifically for the Penn Foundation. We have a specialty chair from Knoll, a giant chocolate bar from Blummer Chocolate.
Awesome.
And many, many other great items.
Perfect. Those sound wonderful. Again, pennfoundation.org. Go check it out there. So Dale, your enthusiasm and passion for the Penn Foundation, it really is contagious. So talk to us a little bit about why you volunteer.
Okay. Well, I think myself, as probably a lot of your viewers, have personally seen firsthand the impact that mental health challenges and drug and alcohol addiction can have on an individual and a family. And I also know how important it is that the behavioral health care provider is getting the right combination of client and healthcare provider. And Penn Foundation does such an amazing job partnering with these people in this very difficult journey. Their staff is so compassionate, empathetic, kind, caring. It's really humbling. They're just amazing. And as I'm sure my volunteers out there would agree that, you know, we're pretty proud that we volunteer for this organization and that we can give something. We can help with this Hope-A-Thon to help support all the good things they do.
Absolutely. And you must have a really wonderful committee that you work with. And especially this year, I know everybody had to pivot. You couldn't have your usual big gala. So you've really had to work together as a committee to make this happen and to pull together all of these baskets and some unique ones this year.
We do have an amazing committee. We really do. Four of them are here that's on the committee, and there's a lot more out there. But, you know, our committee is represented by Penn Foundation employees, area business representatives, and also community representatives. Oh, I just saw.
Yes.
It was a picture of.
It was a picture from your last virtual meeting, right?
Yeah. Not everybody's there, but
there we go. Yes,
I know. Look
there
at
it
us.
is.
You know, we have so much fun. I'll tell you. If anybody out there speaks to your heart tonight, and you'd be interested in joining our committee, we'd love to have you. And you can certainly go to the website or give them a call. But we have a lot of fun, a lot of dedicated folks, and we do a lot of amazing work.
Absolutely, you sure do. Well, thank you so much, Dale,
Well,
for being with
you.
us and showing off all these fun items.
Yes, thank you.
All right, we'll talk to you again in just a little bit.
All right.
In the meantime, in addition to the Hope-A-Thon committee, there are some others that we should thank at this time. So let's hear another message from one of our founding Hope-A-Thon sponsors, Univest Financial and WFMZ TV.
8:35, please.
Oh, I forgot my wallet.
Been there before.
Thanks. How can I repay you?
You could pay next time. Save yourself the embarrassment. Link your Univest card to your mobile wallet.
For over 40 years, the region has turned to 69 News for local stories that matter, from the people you know and the news you trust.
We work here in our community and take pride in our responsibility to provide trusted news, traffic, weather, and sports updates.
On TV, online, and everywhere you go with our mobile app, 69 News is your best source for information when you need it most. Now.
69 News, the people you know, the news you trust.
Honey, did you find your debit card?
Nope. Disabled it.
Did you deposit my check?
I sure did.
And transfer money to Abby?
Done.
Wow.
Stay connected with the Univest app because we could all use a little more wow.
Thank you for watching Penn Foundation's Autumn Hope-A-Thon. Brought to you by American Heritage Credit Union. We offer you the right financial solutions because your family. And St. Luke's University Health Network, the care you trust now more than ever.
Do you want to have your child see the pediatrician, but you wonder if now is a safe time? Well visits and vaccines are more important now than ever. St. Luke's Pediatrics offers options to streamline your visit, like over-the-phone screenings before you come in, virtual visits you could do from home, and some practices even offer curbside consultations. St. Luke's wants to keep you and your child safe and healthy, so call us today. St. Luke's, my health, my hospital, our community.
This next story is one that echoes throughout many of our communities, one that may have echoes in your life or the life of someone that you care about. Brian is no stranger to just how dangerous and disruptive the opioid epidemic can be. After struggling with addiction for decades and going in and out of treatment, Brian has found hope. And while he's still in the early stages of sobriety, Brian has benefited from having a peer specialist. Now, what's different, however, from the peer specialist that you heard earlier in this program begins for Aetna insurance clients as soon as they enter Penn Foundation's inpatient drug and alcohol program. Penn Foundation's quality programs and positive outcomes led the agency to being named an Aetna Institute of Quality facility. Now, because of the Aetna program and his peer specialist, Brian is on his way to living a life of hope. Let's watch.
So, like, just growing up, I had a really tough time fitting in, talking to people, just doing anything. And, like, I just had anxiety about everything. And when I started, you know, doing drugs or drinking, it made me feel comfortable doing anything and everything. And by the time I got out of high school, I was using regularly just to function every day. I struggled at work. I struggled with my family life constantly. I turned into a different person. Like, I was constantly dishonest. Everything was a challenge for me. Like, and my whole life was revolved around where am I going to get my next drug or drink so that I can get through the day. I was given an ultimatum. It was either go to jail or go to rehab, and I decided I'm coming to rehab because I didn't want to spend any more time in prison. So I came here and had a really good experience. Getting into these recovery programs was like the biggest thing for me because it introduced me to people that were like me and that I could relate to and that would support me no matter what, and they could relate to anything I had gone through or was going through. So, like, that was huge for me because I've never had that in my life. So the Aetna program started the first morning I woke up an inpatient. They called me down and introduced me to Ryan Schwager, who was my peer support through Aetna, and I guess he works here for Penn Foundation. My whole stay here, he stayed in contact with me, came to see me, took me for a haircut one day, which most places I don't think people get to go out into, the real world and get haircuts, so that was really nice. He also, once I got out, was able to take me golfing. He's always been in contact with me the whole time. Having the Aetna program really helped me when I got out of rehab because I had supports already set in place for me to help me as I got out into the community and started to rebuild my life. I was also given some apps to put on my phone for recovery, and they were a big help holding me accountable for what I did when I got out. I was given a breathalyzer, I was given drug tests, that I was given random alerts that I'd have to take them whenever. It could be 2 o'clock in the morning, 3 o'clock in the afternoon, but it held me accountable for everything I did. The thing I'm most proud of is being able to rebuild my relationships with my family and friends. It's been huge to be able to have a relationship with my kids. I'm a grandfather now and I actually get to see my grandchild, and it's just a blessing to be able to do stuff like that. Because for years and years, I really didn't have a relationship with my kids or my parents or anybody, my brother, no one, because nobody wanted to be around me. But because of being in recovery and getting sober and changing, how I act, how I think, everybody is giving me a chance and trusting me again. To be trusted again, even if it's just a little bit by people, it's huge for me. I struggled for 20 years of my life, doing the same thing, and I've rebuilt everything in my life in the last a little over 7 months now. So, it's possible. Anything is possible as long as you want it. And that's the thing, you gotta really want it in your own mind. Anybody can tell you they want you to do it, but unless you really want it, it's not gonna work for you. The biggest thing here was the staff for me. Just the people here, I really feel like they're family to me. They've treated me with respect. They've helped me with anything and everything I've ever asked. It's like home to me almost, and it's like they gave me the best gift I've ever had, which is sobriety.
The best gift indeed. Now, we've certainly heard some wonderful stories so far. And what really touched me most about Brian's story was his comments around relationships. These diseases hurt so many people. Addiction doesn't just hurt those who are actually suffering with the disease, but to hear Brian's hope for the future, to build relationships with his children and grandchildren, it truly is inspiring. So we bring Wayne McGrower back now, Penn Foundation CEO. So Wayne, before we talk about the opioid epidemic, I have to say that in general, these stories have really talked about how the staff and everybody at the Penn Foundation makes them feel like family. How does that make you feel to hear that?
It makes me feel great. I really think that that's what this is all about. People, of course, expect professional care provided by exceptional clinicians. But beyond that, when you hear clients talk about compassion, dignity, the fact that people, have hope for them, that's infectious. And I think that we see that with our clients, we see that with our staff. Quite frankly, addictions, these are very, very complicated illnesses, very difficult illnesses to treat. We talked about remitting, relapsing illnesses and lifetime illnesses. We see that in general medicine. We see that in addictions and mental health. So the fact that people talk about what goes beyond the traditional treatment and how that makes a difference, that's exactly what we hope to do.
Absolutely, and it seems like you certainly are doing that for so many people out there. So let's talk quickly about the opioid epidemic. It's one that I feel like in the news we used to talk about almost daily, but now with the coronavirus pandemic, we aren't hearing as much about the opioid pandemic, but it is one going on simultaneously, right?
Absolutely, and it's understandable. 220,000 Americans have died from COVID-19, and it's changed all of our lives. But one of the things that we talk about at Penn Foundation is that we're really fighting two pandemics at the same time. So last year, 70,000 people died of overdoses. And We don't have the numbers for the last 6 months, but there was an article in today's Inquirer that talked about the fact that, those numbers are increasing. What we're beginning to see associated with COVID, and we're not just talking about the obvious and immediate impact of COVID in terms of medical illness, but the isolation. People are depressed. People are anxious. People are using more drugs than alcohol. We're seeing bad outcomes that come from that. And, absolutely, that goes on. So our focus on that has not diminished. Clearly, the way we provide care is very, very mindful of CDC rules and regulations and protocols so that we keep people safe. But what we see is more demand, and I often refer to the fact that, somewhere out there as the COVID-19 crisis abates, we're going to see a tsunami of need and demand for behavioral health and drug and alcohol services.
Right, that demand certainly seems like it is going up, and you guys are there and ready to help out.
And that's why this Hope-A-Thon is so important.
Absolutely. We hope that everybody out there will donate and call and get involved with the Penn Foundation. We also want to talk about how last fall Penn Foundation put together a video to raise awareness of the ongoing opioid crisis and the treatment that Penn Foundation has available to the community. So let's take a look at how they can help.
We support people in the community suffering from an opioid use disorder in a variety of ways. We have inpatient programs, we have partial hospital programs, we have intensive outpatient programs, we have traditional outpatient programs, we have mobile engagement services that are focused on reaching out to individuals and families in the moment of their immediate need. But what makes us somewhat unique is that we have all of those services. People can really stay connected to a group of clinicians. We can develop beyond inpatient care an outpatient aftercare program that keeps them connected with our clinicians, our program, with an alumni group, and really helps them build the supports they need in the community after discharge to go back to an independent and healthy life.
And what we do know from the research and what we see with the individuals we serve is that the longer an individual stays engaged in treatment, the longer they are, the more successful they are in their recovery.
So there's been a lot of progress made in terms of treatment, particularly in this community, with the kinds of supports that we've discussed, that we've received from governmental payers and from private charitable support. But that said, there's so much more to be done. So the thing that we're mostly focused on and that I'm mostly concerned about is what can we do to reach out to the 75 to 80% of people who have a treatment need who aren't receiving treatment.
Penn Foundation's programs and expertise in helping individuals struggling with an opioid use disorder is remarkable. Not every community can say that they have these services in their backyard, helping individuals find hope and recovery. So here's where you come in. Penn Foundation needs your help to ensure these life-saving services remain available to people like Brian. Too many lives have been lost as a result of this disease. If you feel inspired to help people get their lives back, please call the number on your screen with your compassionate gift. Unfortunately, I know that there are some watching right now who are missing a loved one. As you consider calling with support, please know that you can definitely make a gift today in memory of your loved one. Again, the phone number is on your screen right now. It's 610-841-4441. So our next musical performance will also help us remember those we've lost as a result of addiction. 40 Foot Road, a local a cappella singing group that first met on the campus of Doc Mennonite Academy in Lansdale, Montgomery County, will be sharing the song Calling My Children Home. While a moving song on its own, I think this is even more touching because one of the group's singers is no stranger to Penn Foundation. James Mast, the bass singer in the group, is also a therapist, working with children and adults in Penn Foundation's mental health outpatient program. James shared with us that he truly feels called to serve and asked that we share a scripture message along with his group's performance. So this verse is from 1 Corinthians chapter 12, verse 7. Spiritual gifts are given to each of us so that we can help each other. James said, and I quote, "It brings me great joy to work for an organization that lives out this verse every single day." And now, I hope you find joy in the gift of music shared by 40-Foot Road in their rendition of the hymn, Calling My Children Home.
Those lives were mine to love and cherish, to guard and guide along life's way. Oh, God forbid that one should perish, that one, alas, should go astray. Back in the years, we're all together, around the place we'd romp and play. So lonely now, I often wonder, oh, will they come back home someday? I'm lonesome for my precious children. They live so far away. Oh, may they hear my calling and come back home someday. I gave my all for my dear children, their problems still with love I share. I brave life's storms, defy the tempest, to bring them home from anywhere. I lived my life, my love I gave them, to guide them through this world of strife. I hope and pray we'll live together in that great glad hereafter life. I'm lonesome for my precious children. They live so far away. Oh, may they hear my calling, and come back home someday. I'm lonesome for my precious children. They live so far away. Oh, may they hear my calling, and come back home
All right, that definitely gave me chills and was an absolutely beautiful hymn. Thank you so much, 40-Foot Road, for that. I think that your music and the stories that we've been hearing and the impact Penn Foundation is making have inspired so many people to give. So I want to get right to Kim Detweiler. She's the Vice President of Advancement and Communications at the Penn Foundation. So we want to get a quick update on our fundraising right now.
Yeah, so it's going very well. We're just so grateful for the generosity of everybody that's been calling in and the support that's been coming. The online auction is going well as well, but we're still just over $100,000. But we really had an exciting development during that last musical selection. Yeah,
Okay, what's our breaking news, Kim?
So we had a generous donation, and I'm going to look at my notes here just so I don't get this wrong. But Tom and Tina Luce are offering a $5,000 matching gift, with a second match on top of that from the Merck's Employee Matching Gift Program. So this is a great time to be calling in with support because your support will be tripled.
Right, so if you donate $50, that equates to a $150 donation, is that right?
That's absolutely right. So this is a great time to be calling in your support. It'll go even further.
Right, to triple them, that is awesome. So again, the phone number is on your screen. It's 610-841-4441. So I want to hear these phones ringing right now. And tell us a little bit more about why people should call right now.
Penn Foundation is a wonderful organization, and the 27 programs that we offer our community really help individuals of all ages, and we count on our community support. You know, we're celebrating 65 years. Today marks our anniversary, and we would not be able to be here without the support of our community. The community helped us get us started 65 years ago, and it's what keeps us going each and every day.
Absolutely, and I hear that support coming in right now. I hear those phones ringing off the hooks. Again, if you donate right now, your donation will be tripled. So that's incredible. Just so generous of that couple to donate that. Now, some gave just by learning about the event, while other people have already pledged their support tonight. So let's recognize some of our sponsors.
Thank you for watching Penn Foundation's Autumn Hope-A-Thon, brought to you by our presenting sponsors, American Heritage and St. Luke's University Health Network. Our founding sponsors, Bergey's, Locker, Univest Financial, and 69 WFMZ TV. Instilling Hope sponsors, Thomas and Judy Leidy, Penn Community Bank, Dorothy K. Week-Hange Esquire, and Philip Hange. And building community sponsors, thank you for your support.
Well, the two presenting sponsors, American Heritage and St. Luke's University Health Network, we've got a huge long list of all the sponsors, so thank you so much to them. Definitely impressive list of them to help us get to our $150,000 goal. So please, again, take a moment and make your gift of impact now. And while we do that, we're going to take another quick break to hear these messages from our generous presenting and founding level sponsors.
Hi, I'm Matt Gottschall, Personal Sales Director at Locker. Every day we're fielding calls from people like you looking to save money, and every day we're gaining more satisfied clients. Right now is truly a great time to talk as rates are dropping and people are getting more for their money. Find out where you stand. Call us or text today. It's that easy.
Thank you for watching Penn Foundation's Autumn Hope-A-Thon, brought to you by American Heritage Credit Union. We offer you the right financial solutions because you're family. And St. Luke's University Health Network, the care you trust now more than ever.
Imagine a financial institution that you own. What does that look like? Would it provide tens of thousands of free ATMs? Maybe it'd be a not-for-profit that gives back millions to its members and community. The kind of place where the CEO is just as accessible as any other team member. A revolutionary partnership forged in your neighborhood and still standing strong after nearly a century. That's American Heritage Credit Union. Start your own financial revolution today.
Welcome back to the Autumn Hope-A-Thon. I have Wayne McGrower here with me again, Penn Foundation CEO. So Wayne, Penn Foundation is an incredible organization. I know this is certainly a very challenging time right now. So you've managed to navigate the pandemic, care for your clients, and continue your outreach by hosting tonight's event. So tell us, why is this event so important for you?
Well, it's so important, Melanie, because so many of the services that we provide are either underfunded or unfunded. So one of the goals of Penn Foundation is to care for the entire community. And unfortunately, insurance reimbursement hasn't always kept pace with cost. And as you may well know, when it comes to behavioral health particularly, mental health parity was only passed in 2008. So there's a long history of mental health funding not keeping pace with funding that's equated with medicine and surgery. So charitable giving is just critical to us and to our ability to ensure access and services are available to people when they need them.
Absolutely. And the Penn Foundation has been providing those services for 65 years, and today is actually a very important and exciting anniversary.
It is a very exciting anniversary. 65 years ago today, our founding medical director, Dr. Norman Laux, saw his first patient in the first Penn Foundation office in Souderton.
That's
and
awesome.
That is it's a remarkable anniversary. So much has been done for the community, and it's all been possible because of the support of the community.
Absolutely. And you talked about some of the honors of the Penn Foundation. One thing was being recognized as a model for the country shortly after it was founded, right?
Exactly. I think the thing that's important in that is that Penn Foundation was founded by a group of Mennonite men who were conscientious objectors, who did alternative service in World War II in psychiatric hospitals. And they saw the conditions that existed, came back to the community, and wanted to do something different and better. And they wanted to provide services that actually kept people out of the hospital. And even though there's recognition that there are times when people need to be in the hospital for medical, surgical, behavioral health reasons, the goal is not to go there initially. The goal is to try and keep people, living in their community in the supportive constructs of family, place of worship, business, friends, family.
Absolutely. Try to get them at that grassroots level before they have to, right?
And that was a rather revolutionary thought in 1955, when many people were being hospitalized for services that we would really now provide on an outpatient basis.
Right. And when did they first get this national attention for this new approach?
Well, in 1964 and 1965, there was an act passed called the Community Mental Health Centers Act at the federal level, and Penn Foundation was one of 17 community centers that was identified to serve as a model for that legislation.
Okay. And I'm sure that recognition definitely helped them garner even more support. So we have a clip now from a conversation shared by Dr. Laux, Penn Foundation's founding medical director, and Dr. Michael Peters, who was then the chief of medicine at Grandview Hospital, recalling the earlier years. Let's take a look.
People had gotten the idea that psychiatric patients could be treated and could get better. And they were beginning to develop an interest in community mental health. They felt that psychiatry should be more closely related to medicine. All of these were revolutionary ideas. And I can't help but feel that there was a generous spirit of responsibility for neighbor here in this community. And there was a kind of a unique blend of medical interest, community interest, and community leadership.
That's part of the soil out of which the foundation grew. There were pastors talking to Mike Peters and kind of saying, where do we go? We need somewhere to refer people who have these kinds of illnesses, that people wouldn't have to be sent away out of the community. I think that was the real genius of the foundation. I feel hopeful when I think of all that we've negotiated from 1955 until now, and still being a very, I think, important contribution to this community, providing much needed and appreciated services There's a lot of satisfaction in being able to walk with people in their perplexity, some of whom I've seen over decades. This again is kind of where my heart is. Part of the caring for the patient is to care for the patient, and that's to listen, and that's to take time and try to put the story together and to kind of make room and to kind of be there. Remember, sometimes you are the medicine the person needs. Just learn how to prescribe yourself.
Everyone's invited here. Those are words that anyone struggling to find hope needs to hear. So what an incredible vision, insight, and inspiration. So if you want to view the full documentary of Dr. Kratz's legacy, you can find it on Penn Foundation's YouTube channel. Now it's time for another client story, and we've heard about a few of Penn Foundation's programs already that support individuals, but did you know that Penn Foundation also partners with businesses through its EAP program, which stands for Employee Assistance Program? So next up, we'll meet Dr. Christopher Hay, Assistant Superintendent and Director of Human Resources for Souderton Area School District in Montgomery County. There's no question that school districts present unique staffing challenges, especially in a year like 2020. Let's listen as Chris shares with us how having access to counseling, educational programming, and other support has helped their faculty and administrators' lives stay in balance.
The Souderton Area School District started with the Penn Foundation Employee Assistance Program 5 years ago. Prior to that, we had an employee assistance program through a different vendor, but we switched over to Penn Foundation's EAP because of the personal touch and the community connection that Penn Foundation has in our local area. And again, that personal feeling, knowing that the people that are providing the services to the employees in our school district are community members. Penn Foundation has a really strong presence and a really great reputation in prevention and treatment. We knew that we needed an employee assistance program because all employees, all people need help sometimes. And that's not unique to Souderton Area School District. I know that our staff are grateful about having the Employee Assistance Program because I know that we have a relatively high usage rate, and also anecdotally I hear from staff members very often about what a benefit the EAP program has been to them. One of the services that Penn Foundation provides are training services for our staff. Multiple times throughout the year, I'm often on the phone with the folks at Penn Foundation EAP to say, hey, I need a dedicated training for this particular area. And it's not uncommon for one of our employee groups also to say, you know, our crew could really use this support in this specific area, or I have an individual who needs some help. Penn Foundation EAP also offers mandatory referral programs so that if I have an employee that I know needs some support, I can require the employee to go, and I've had to use that with great success in the past, and it's really a supportive measure to help an employee to get through a tough time. On March 13th of 2020, all schools in Pennsylvania were closed because of the emerging pandemic. That was a world changer for every American, people across the world as well, but particularly in schools because we're not used to being closed. Schools work best when kids are in their seats and with their teachers because the social and emotional aspects of being in school are critical to education and child development. And teachers too, that's why they're in the profession. So when schools closed and we were suddenly teaching remotely to kids, it was something that we weren't prepared to do. And the stress and mental health issues that came along with that, not just for students, but for also our staff, were significant. And my administrative team as well. It was something we've never had to deal with before, and we weren't prepared to cope with it. So we reached out to Penn Foundation EAP and asked that they provide sort of a workshop, virtual of course, for our staff members who were having trouble coping with the stress and anxiety that came along with that. Teachers were trying to teach their kids virtually. They had their own kids in their homes who needed their support as well, and it was just incredibly stressful. We also arranged for sort of a call-in service for teachers individually or any staff member to be able to reach out and say, I need some support here. And because they couldn't come do it in person because we were on lockdown, they were able to do that. And Penn Foundation EAP program made that easy for us to do and to provide that support to our staff members. I want to congratulate the Penn Foundation on its 65th anniversary. That's an amazing milestone. This community is stronger because of the Penn Foundation and for organizations like it. Our families, our staff members, our students have never needed more support. And it's places like the Penn Foundation that provide that support. Without an organization like it, we would be a different place. And we might not be able to do the things we're trying to achieve. I encourage the viewers today to be part of those solutions, and if you feel like you want to lend a hand, this is where you can do it. This is where it will make a difference.
And you can make a difference by calling in right now. Thank you so much, Chris, for sharing all that Penn Foundation has done to partner with your school district. So I'm joined again now by Wayne. So Wayne, talk to us a little bit about how COVID has really changed mental health and the workplace.
Well, I think that COVID-19 has affected all of us. Mm-hmm. It's changed our lives. It's changed our social lives, our family lives. And what we're seeing is that stress has impacted everything that we do. It's also required us to provide service in a different way. One of the things that was really exciting, Melanie, was to hear Dr. Laux on this day particularly. As a young man who worked for Dr. Laux, he used to talk to me about the caring community. And in 1980, he talked about if Penn Foundation was truly going to succeed, it would have to be part of the caring community and have strong relationships with the worship, with the clerical, pastoral community, with the business community, with the educational community, and with the law enforcement community. And what you heard from Chris Hay was an example of that. What you heard when he talked about EAP was for our 25th anniversary in 1980, the goal was to set up a program for local houses of worship and a program for local businesses. And the EAP program was set up then because it was recognized that people have personal issues that they bring to work. It's really hard to separate what happens at home from what happens at work. So it became a counseling program without, quite frankly, at the time, the stigma of a counseling program that was paid for by employers. It's really gone on to be much more than that. And I'd love to talk about that some other time. But the important thing here is that it's a way that Penn Foundation reaches out, now virtually, although we're doing some services face-to-face very carefully, but largely virtually to employers because we recognize the fact that their issues, even though there's a line that separates what happens personally from professionally, sometimes people's issues cross that line.
Absolutely, and especially right now with many people working from home, there really is a very, very, very small line at this point.
The pressures are enormous. So one of the things that EAP has done is they've been providing training programs. We have 80 contracts right now in the community with small businesses and large businesses, but they have been doing programs with regard to how to manage stress, anxiety, and how to really understand, you know, what to do as a supervisor, as a parent, as an employee, how to manage this really unusual situation.
Mm-hmm. It truly is a unique situation, but it seems like you guys are just helping so many people through your employee assistance program as well as your other program. Thank you so much, Wayne. I will check back in with you in just a little bit. So I want to remind you of the number to call if you would like to call and donate. It's 610-841-4441. It is along the bottom of your screen right now. You can also visit pennfoundation.org, and online there you can also see some wonderful auction items. I checked them out really quickly during a break a little while ago, and there's some things on there that I want to bid on, I think. So we're going to check back in now with Dale, and she's here going to give us a fundraising update. I've heard those phones ring several times. How are we doing right now?
Very well. It's really exciting. We're making great progress. During the last half hour, Kim shared about our matching donor of the $5,000, and well, since that we raised $4,225, which is really another $12,675 for the Penn Foundation, which brings our total to $116,100.
Oh, that is amazing! Yay! Congratulations, and thank you to everybody who's donated so far, and keep those donations coming. So I want to talk a little bit about the online auction. You've got some really neat travel packages on there right now.
We do. You know, so many of us aren't traveling right now.
Right.
So with the pandemic, And so this is a great opportunity because all of these trips are good for 2 years. So if you bid on one of these trips, you win, you have 2 years to take a trip. A couple really exciting. Charleston Luxury Getaway for 2, featuring a 3-night stay in a deluxe room at the Belmont Charleston Place Hotel, several meals, history and photo walks, and a round-trip coach airfare.
Wow.
Round trip. We also have a golf getaway. This is this trip is a 3-night stay for 2 to Pinehurst Resort, North Carolina.
All right.
And it includes daily breakfast for 2, 3 rounds of golf per person, and on their famed greens.
Oh.
And then we've got, if you're looking for more of a local experience, we've got golf at 4 for Indian Valley Country Club, Bella Vista Country Club, and if you're up for a spa weekend, there is a spa weekend at Bear Creek Resort, which if you've never been to Bear Creek,
it's amazing, absolutely beautiful. You do, yes,
really amazing.
yes.
So you want to try that out. And dinner and an overnight stay at the Tower Suite at the Washington House. So some really, really...
Yeah, whether you want to travel far and go to the Carolinas. I'm from North Carolina, and I also have family in South Carolina now, so a little partial to those packages, but the ones in our backyard are wonderful as well.
Very good.
So again, you can go online and you can bid now. The bidding will be open until 5:45, so you have just a little less than half an hour. So log on, check out all of those for sure. And before we get to our next musical performance, I want to acknowledge some additional Hope-A-Thon contributors. Rotating on your screen now are our $500 level partner sponsors, our $250 level friend sponsors, and our $100 contributors. Thank you all so much for your generosity. Now, it's overwhelming to see the support come in for the Penn Foundation right now, and we are so lucky to live in such a generous community. While we've been highlighting some of our more significant contributors, please know that any amount you can give will help support Penn Foundation and the more than 20,000 clients they serve annually. Whether it's a $10 donation or a $10,000 donation, you give hope to someone in need when you support the Penn Foundation. And let's not forget about that matching opportunity that Dale mentioned. Now is the time to give, and as you heard, the demand for Penn Foundation services is only going to rise as we look ahead. So please consider how you can help. Our volunteers are standing by right now to take your calls and help you make a difference in someone else's life. So on your screen now is the number to call in with your donation, so check it out on there. It's 610-841-4441. All right, well, I don't know about you, but I'm ready for another musical performance. I know how much we all enjoyed Craig Thatcher and Nick Van Wyck's first original piece, so let's get ready for another favorite. Together again, performing their original work, Craig Thatcher and Nick Van Wyck with Before I Go.
Before I go, there's something I just gotta say. I wanna let you know my love for you grows deeper day by day. Everyone told us that we'd never last. Where are they now? Memory in our past. And I guess we showed them just how strong love can be. In a little while I'll be on a plane again, flying high above the sea. Yes, it's my job and I love it so. There's another place I'd rather be, back in your arms in our little home. Ain't a mansion, but it suits us fine. Out in the yard with the kids and the dogs, just watching the world go by. Before I go, there's something I just gotta say. I wanna let you know my love for you grows deeper day by day. Everyone told us I guess we showed them just how strong love can be. I'm not complaining about what I do. It's the best job in the world for me. Many people spend their lives regretting the way things turn out to be. Oh, but the road gets lonely, and I want to come home. No place else can do it, you see. So while I'm away, my heart's always with you. Close your eyes and think of me before I go. There's something I just gotta say. I wanna let you know my love for you grows stronger day by day. Everyone told us that we'd never last. Where are they now? A memory in our past. I guess we showed them just how strong love can be. Everyone told us that we'd never last. Where are they now? Memory in our past. I guess we showed them just how strong love can be. Yes, together we showed them just how strong love can be.
What amazing talent and what a great message about the power of love in that performance by Craig Thatcher and Nick Van Wyck. We are so thankful to these talented performers who all contributed to tonight's event. So while these musicians are not able to perform live right now, they were so generous to make the time to share their music with us. Craig Thatcher performs locally, and I encourage you to learn more about him by going to CraigThatcher.com. Now let's get to our final client story. This next story offers so much hope to those who are out there struggling to find a connection, have the courage to share their talents, and make their way in the world. For years, Chris's world was his imagination and his boundless creativity. He put everything into his art. But while he was making time for his art, he was also missing out on forming friendships and many other milestones typical of young people his age. It wasn't until he came to Penn Foundation that, with the help of Wellspring Clubhouse, he was able to open up, form friendships, and share his talent and art with the world. Let's meet Chris.
What brought to Penn Foundation was actually this event that happened back at work. Kind of my mind was kind of like not really stable, and so basically I remember that I pretty much fell out and started screaming. It was like a cry for help, basically, and I was actually calling Jesus, honestly. And I still remember it because that's when the hospital ambulance came, and ironically, I saw, when I looked up, a rainbow in clear skies. They actually suggested me to go to Penn Foundation so I can get the medication that I need, or at least see a therapist to help me, because I used to hear voices. Because of that, since I can discern my own voices in my head from other things. Before I started on this journey, I was kind of like very into my own head. It was kind of like I was sleepwalking in a way. Like reality was not really something I was concerned with. I think I got more stability by coming to Penn Foundation, and they gave me the help that I really needed. I'm an artist, a self-proclaimed cartoonist, I guess, and self-taught. So I really enjoy doing my art and my cartooning, and sometimes even story writing whenever I get a chance. Art is something that's I'm really passionate about. Not even just cartooning, but sometimes poetry and sometimes even making music. Well, how Penn Foundation affected my art now is there was a point in time where I was very secretive about my art, displaying it. But I did learn that art is not art when you don't display it. There's really no point in even making it if no one else sees it but you. My therapist helped me understand that and got to the point where now I'm starting to share my work. I got second place in this art contest. I never imagined me even submitting anything in an art contest, honestly. I put my art on the walls of Penn Foundation. Now I'm really eager to show other people my work. It's like an extension of myself. Like my emotions are expressed through my art. The services I use at Penn Foundation are psychiatry, therapy, peer support, and Wellspring Clubhouse. I'm very thankful for peer support because due to the experience I had with them, it got me out of the house a lot more. I was very introverted and non-social, so it helped me achieve some social goals. My experience at Wellspring Clubhouse helped me actually achieve something that I usually don't really care to do for, which is like make friends, basically. I got to meet like-minded people that share the same interests as me in art and even cartooning. I made a lot of friends and met a lot of interesting people too that helped me understand that I'm not the only one going through this, or I'm not the only one that has mental illnesses in this way. Penn Foundation is like a sanctuary to me. As I go through, the hallways, I see a few things, that catch my eye, and there's these messages. It might be a prayer message on some walls, or it might be an inspirational poem. It made me realize what Penn Foundation was founded on. I believe it's founded on God. I pray that one day I'll be able to influence others in a positive way in mental health, just like these people in Penn Foundation. They were that tool that I needed to get through a lot of things that was holding me back or binding me.
Wow, thank you so much, Chris, for sharing your story. I know it certainly took a lot of courage, and we admire that so much. And your art really is inspirational. So Wayne is back with me now, and you actually have an original work of art by Chris. Tell us about this.
Well, I think that Chris's story, I know I speak for all 500 people at Penn Foundation. When I hear these stories, we are so inspired by the stories of our clients, and really, Melanie, it's a privilege to walk with them on their journeys of recovery. And I think when you hear Chris's story and you look at this art, you understand the potential that Chris has as a human being, the recognition that there's that of God in all of us. And we are just privileged, and we're appreciative that Chris has added this as one of our auction items.
That's awesome. So you can actually
bid
on this right
this
now.
Beautiful piece of art.
That's
this
wonderful.
framed piece of art that was highlighted in the video.
That's great.
And we thank Chris for that.
Yes, thank you so much, Chris, for donating that. Again, pennfoundation.org is where you can go right now to bid on that. And we want to talk a little bit about a mural that is there on campus as well. It was done in partnership with Brush with the Law, right?
It was, and one of the things that we're very excited about is that we want our environment to feel therapeutic, to feel welcoming. And I think you've heard that theme today. The Penn Foundation campus, as it's been built over the decades, was always meant to feel something other than institutional. The goal was to make it feel welcoming, to make it feel like home. And for example, the mural that you're talking about was actually painted in one of our Village of Hope homes.
Wow, that's great. And we're looking at some images of it right now.
And these are homes for 8 men and 8 women, 2 separate homes. It's a program that we provide for Bucks County for people who have drug and alcohol histories and who have been homeless. It's the only transitional living program in the county. So it really, supports our ability to help people regain the skills necessary to live full and productive lives.
Right. It seems like such a comprehensive program that the Penn Foundation offers. So thank you so much, Wayne.
Thank you.
I think we are going to move along to our last musical performance now. And this one is by 40 Foot Road. It is called Little Lamb.
Little lamb, little innocent lamb, I'm gonna serve God till I die. Little lamb, little innocent lamb. Innocent lamb, I'm gonna serve God till I die. Hypocrite, hypocrite, tell you what he do. I'm gonna serve God till I die. He'll talk about me, and he'll talk about you. I'm gonna serve God till I die. Little innocent lamb. I'm gonna serve God till I die. Little lamb, little innocent lamb. Innocent lamb. I'm gonna serve God till I die. Devil, he's got a slippery shoe. I'm gonna serve God till I die. Now, if you don't mind, he's gonna slip it on you. Slip it on you. I'm gonna serve God till I die. 'Cause there ain't no dying over in that heavenly land, that heavenly land, that heavenly land, that heavenly land, that heavenly land. No dying over there. No dying over in that heavenly land. There'll be joy, joy, joy. Just take one brick from Satan's wall. I'm gonna serve God till I die. Satan's wall's gonna tumble and fall. I'm gonna serve God till I die. Little innocent lamb. I'm gonna serve God till I die. Little lamb, little innocent lamb. I'm gonna serve God till I die. 'Cause there ain't no dying over in that heavenly land, that heavenly land, that heavenly land, that heavenly land, that heavenly land. No dying over there, no dying over in that heavenly land. There'll be joy, joy, joy.
Oh, it looks like they definitely had a great time with that one. Thank you so much, 40-Foot Road, for sharing your gift of music with us. For more information on 40-Foot Road, please check out their Facebook page. And in studio now, I want to bring back in Dale Westwood, the Penn Foundation's Autumn Hope-A-Thon Committee Chair. So Dale, give us an update on our total so far.
Okay. Well, so far, we have raised $121,365.
Yay! That's incredible.
Yes, and you only have 7 more minutes to bid on the silent auction, so.
All right, time's ticking, and
Yes.
that $121,000 doesn't even include the total
No,
from that, right?
I don't believe it does. No.
Wow, all right.
It's pretty exciting.
Very cool. Now, speaking of exciting,
Yes.
if I may say so myself, there's a pretty fun auction item in there that people might not know about if they haven't checked it out yet.
Yes, there is a very fun where you can get a tour at WFMZ, meet Melanie and your co-host Jim Vaughn, and the winning bidder will also get to sit in on to watch the 4 o'clock news.
Yes.
So I know I've had so much fun here, so I can imagine that this winning bidder will have an awesome time.
Absolutely. I think they'll have fun. We'll make sure to take very good care of them.
Yes.
I think you guys have seen some of the antics of my co-anchor running around behind here waving. So we definitely do have fun. So all right. Well, Dale, thank you so much.
Thank you.
We are going to take a quick break now to hear some of our sponsor messages. But before that, I want to remind you to call the phone number and donate 610-841-4441. And again, go online. Only, we're down to 4 minutes, guys. 4 minutes until that auction closes. So bid and call, and let's hear from our sponsors.
835, please.
Oh, I forgot my wallet.
Been there before.
Thanks. How can I repay you?
You could pay next time. Save yourself the embarrassment. Link your Univest card to your mobile wallet.
69 News Election Central knows how to cover a historic election with live updates from around the region and across the country. The 69 News team has the most current results of any news source in the area. On TV, online at WFMZ.com, and everywhere you go on the 69 News mobile app. The experience and depth of the 69 News team is unparalleled. When big news happens, the region turns to the source they have trusted for over 40 years. 69 News, your life, your world, your news.
Honey, did you find your debit card?
Nope. Disabled it.
Did you deposit my check?
I sure did.
And transfer money to Abby?
Done.
Wow.
Stay connected with the Univest app because we could all use a little more wow.
Thank you for watching Penn Foundation's Autumn Hope-A-Thon. Brought to you by American Heritage Credit Union. We offer you the right financial solutions because you're family. And St. Luke's University Health Network, the care you trust now more than ever.
You don't have to be a superhero to feel like one. Wear a mask and help slow the spread of COVID-19. The Centers for Disease Control recommends wearing a cloth face mask in settings where social distancing measures are hard to maintain. St. Luke's requests that all visitors and patients wear a mask. A mask can help prevent the spread of the coronavirus by blocking droplets as we speak. Wear a mask and help slow the spread. St. Luke's. My health, my hospital. Our community.
Welcome back. We've learned so much during this broadcast about Penn Foundation. For 65 years, they've been serving the behavioral health needs of our community. Now joining me again to talk a little bit more about what's ahead for Penn Foundation is its president and CEO, Wayne McGrower. So Wayne, we've talked a lot about how COVID has impacted the Penn Foundation. So tell us about some more of those things that it's changed.
Well, I think it's a time for innovation. It's a time for creativity, and it's, I think, especially fitting that we talk about that tonight on our 65th anniversary. So one of the things that we've done, I think successfully, over those 65 years is listen to our community and listen to the community's needs. So we intend to continue to do that. I think people want convenience in their life, and what we've learned is that we can use telehealth, which was a medium that really we didn't use significantly before COVID-19, but we're now using it very successfully. And in the surveys that we've done, our clients like it. Frankly, our staff likes it. We know that there are times when it can't be used or it's not appropriate. But for many routine things, it's fine. And it gives people an ability to get the service they need, the way they want it, how they need it in real time. Absolutely. So we're very excited about that. And I think the other thing I would say, Melanie, is that COVID-19 has reminded us of the importance of partnership, of collaboration with healthcare organizations like St. Luke's University Health Network, with the pastoral community. We talked about schools. We talked about corporations. We recognize the fact that we can't do our work unless we're working in partnership with them, and that partnership has never been more important.
No one can do it alone.
We can't do it alone. And that's why tonight has been so extraordinary, and that's why we're so grateful.
Yes, absolutely. Thank you to everybody who has donated so far. And you can still help ensure the sustainability of Penn Foundation's vital services by calling in your support now. We're nearing the end of this incredible Hope-A-Thon, and I'm very optimistic that we will reach that $150,000 goal. Our friendly volunteers, they are still here and still waiting to take your call. The phone number again is 610-841-4441. Please also get your final bids in. It is 5:45 right now. You might be able to sneak in that last one. And in the meantime, we're going to enjoy our final musical performance of the evening by Michael Borowski, composer and pianist, playing Adventures of Bella and Charlie.
Thank you for watching Penn Foundation's Autumn Hope-A-Thon. Brought to you by American Heritage Credit Union. We offer you the right financial solutions because you're family. And St. Luke's University Health Network, the care you trust now more than ever.
Welcome back. Thank you again, Michael, for sharing adventures of Bella and Charlie with us. This certainly has been an inspiring afternoon, and we're so grateful to everyone who has stepped up to help Penn Foundation. As we approach the end of our time together this afternoon, it's time to get serious. I hope that everyone watching has been inspired to offer support. If you haven't called in your donation yet, you still have time, and you can do so right now. The phone number is 610-841-4441. Any amount that you can donate will make a difference in the lives of our neighbors and our loved ones, people who are right here in our community. Our volunteers are ready to hear from you as you reach out to offer the gift of hope today. So as we heard earlier from Wayne and Kim and Dale and others today, this is such an important fundraising event to help sustain Penn Foundation's 27 vital and, as you heard today, often life-saving programs. In addition to calling in support, Penn Foundation is hosting an online auction that will be closing in just a few minutes. Actually, it just closed. Sorry, it closed 5 minutes ago. So again, pennfoundation.org. Thank you so much to everybody who donated on there. We will be sharing the total in just a few minutes. But first, let's hear from some of our sponsors.
Thank you for watching Penn Foundation's Autumn Hope-A-Thon. Brought to you by American Heritage Credit Union. We offer you the right financial solutions because you're family. And St. Luke's University Health Network, the care you trust now more than ever.
Imagine a financial institution that you own. What does that look like? Would it provide tens of thousands of free ATMs? Maybe it'd be a not-for-profit that gives back millions to its members and community. The kind of place where the CEO is just as accessible as any other team member. A revolutionary partnership forged in your neighborhood and still standing strong after nearly a century. That's American Heritage Credit Union. Start your own financial revolution today.
Medical emergencies can and do happen during COVID-19.
One American has a heart attack or stroke every 40 seconds.
And one American dies from stroke every 4 minutes.
Heart attacks and strokes will not wait until a pandemic runs its course.
It is not safe to sit home and hope the symptoms pass. It is safe to come to St. Luke's.
Our EMS crews and ambulances
are ready for you, taking every measure to keep you safe.
And we're live back here in the studio, and joining me is Kim Detweiler, Vice President of Advancement and Communications at Penn Foundation. So Kim, thank you so much for letting me be part of this. I truly have been inspired and learned so much about the Penn Foundation today.
It's been a lot of fun, and we're so grateful to you for hosting and for all of the support from all of our businesses in the community and everybody that stepped up to contribute.
That's right. And speaking of those businesses in the community that stepped up, you actually had so much support that we have some additional sponsors that we need to thank right now,
yes,
right?
We didn't get a chance to recognize everybody earlier, so we have some additional Instilling Hope sponsors. We have Ken and Fran Clemens. We also have Inspiring Change sponsors, the H&K Group, and Dave and Carolyn Landis. And then there's also some additional building community sponsors that are also showing on the screen right now. So we're so grateful for everybody's support. You know, we couldn't do what we do without the support of our community.
Absolutely, it is so important, and that's why we're all here today, and we're really feeling that love. So one way that people were able to donate today was through that online auction. So give us the grand total from the online auction. What did we raise on there?
This has been our best auction ever. So we are at $15,080 is our total. So $15,080. So pretty incredible. So thank you.
Yes, and again, all of those things were donated to the Penn Foundation, and all the proceeds go directly to the Penn Foundation.
Yes,
all
so
of
all
those
the 27 programs, absolutely.
That is incredible. So we want to get our grand total. And again, there are still a few minutes. We have about 7 minutes left that you can still call in and donate. But what are we at right now?
So with the auction total, we're now at $138,250.
All right. That is incredible. Again, our goal is $150,000. So who can help me make it happen? What is that, about $22,000?
Yep. Those phones need to get ringing, right? Keep
They
those volunteers
Let's
busy.
hear them. Yes, call in. And again, no gift is too small. Even if you can only give $5, $5. That's okay. So again, the phone number, I'll tell you one more time, 610-841-4441, or you can visit pennfoundation.org. You can also give online, and you can just keep making those charitable contributions. So thank you to everybody who has donated. So is there anything else that you want to leave us with today?
I think just thanking everybody for all of their support. I think you'll be hearing some closing comments from Wayne here in just a few minutes, but we're just so grateful for everybody that stepped up, you know, in an unusual year with COVID and just unforeseen circumstances. We didn't know what to expect, and we're just overwhelmed by the generosity of everybody. So thank you.
Yes, thank you again to everybody. And tell us quickly, too, I know online and social media, you guys have really delved into that realm as just another way to connect with people, right?
Yeah, you know, in addition to the services that we provide, we want to be a resource to people. So a lot of people are seeking out information about mental health and addiction treatment. And so we have a very robust blog and articles on our website, but we also are very active in social media. So Facebook, Twitter, LinkedIn, Instagram, you can follow us there and get helpful tips and insight into how to help individuals that are struggling.
Absolutely. Do you also use that as a way to connect with people who may not otherwise reach out to you or may not otherwise get those resources?
Absolutely. You know, it's another customer service channel as well. So people contact us through our social channel to seek treatment, and it's a way for us to connect. So we're always looking for opportunities to connect people to treatment, to connect people to resources, and just be a help to our community.
Absolutely. And if somebody is watching right now and they need help, they're struggling, or they're not even sure if they need the help, but they just want to talk to somebody, where can they start?
You know, go to our website. We have a lot of resources, as I mentioned there, but you can also just give us a call. You know, we're here for you, and I think the most important message, you know, during this time is don't delay your treatment. You know, we have all the safety protocols in place with COVID to treat people now, and so give us a call, come in and see us, and we're here for you. Treatment works, as we've heard today from all of the stories that have been shared.
Absolutely. All right, Kim, thank you so much for joining us today. I believe we are going to bring Wayne back in and hear some final comments from him, but I want to remind you one last time that if you can call in 610-841-4441 or pennfoundation.org, there are still a few minutes to give. We've got about 4 minutes of this left. So we've got Wayne coming back in, and again, he is the president and CEO of Penn Foundation, and he has worked with them for over 40 years. You've certainly seen the program grow and change throughout all of these years. What is something really important that you want everybody to walk away from watching this event today with?
I think the most important thing, Melanie, is for people to know that there is an organization out there that is there for them. And that, as you heard through a number of the client stories, Penn Foundation's been here for 65 years. We've only been able to be here because of community support, but treatment is there. It works. It can improve lives. And it's a privilege, really, for Penn Foundation staff to walk with our clients on their journeys of recovery.
Absolutely. I feel just so much warmth and hope and inspiration being here. Wayne, thank you so much for being here and for everything that you do.
And to WFMZ and to, you know, certainly all of our contributors, our sponsors, our donors, to our volunteers, to Dale Westwood, to Kim. This was an idea that really came out of necessity. These funds are so important for us. Clearly, we were not going to have an event this year with 600 or 700 or 800 people, and you stepped up and our volunteers stepped up, and we're so grateful.
Absolutely. What do they say? Necessity is the mother of invention.
And indeed it was, and I think we had a wonderful event today.
I think so too.
And hopefully there were people who not only contributed but learned more about Penn Foundation, what we do, and how we're there for them.
Absolutely. Thank you so much, Wayne. We really appreciate everything. And just because the Hope-A-Thon is coming to a close today, you can still donate and you can still stay in touch with them. It doesn't mean that your support for the Penn Foundation has to end just because this event is. Gifts can be made throughout the year at any time online at pennfoundation.org. One-time gifts can be made, or donors can also schedule recurring donations. Your contribution has a direct impact on the programs that Penn Foundation provides to this community. You can make a difference in someone's life and improve the mental health of your community. Thank you so much for watching, and thank you for supporting Penn Foundation's Autumn Hope-A-Thon. We hope that you've been inspired and entertained. Thank you, and have a great night.
Thank you for watching Penn Foundation's Autumn Hope-A-Thon. Brought to you by American Heritage Credit Union. We offer you the right financial solutions because your family. And St. Luke's University Health Network, the care you trust now more than ever.